Hello, Epidemics in History. Thank you for giving me the opportunity to talk to you guys today. Um, Today, I thought, since we are embarking on Operation Warp Speed to develop a COVID vaccine in the US, it would be useful and interesting to take a look at some past attempts that we've had in history to develop vaccines on a large and rapid scale. Let me share my screen with you. Give me a second. All right. So there we go. The story really begins in 1918 with what we then called the Spanish flu, and which just decimated troops at the end of World War I. And thanks in part to that experience, war planners really recognized infectious disease as a national security threat. And they invested in it accordingly as we faced the beginning of World War II. So fearing that another world war would generate the epidemiological conditions for another pandemic, the US war planners pulled together these vaccine development commissions. Here's Tommy Francis talking about it. He was the chair of the flu commission, which was really the centerpiece of a lot of this. Up till this point, we did not have a flu vaccine. And so this was his job, was to rapidly mobilize academic research institutes, industry, and the military to develop a flu vaccine. And as he says here, based on this experience, the flu and the war were linked in everyone's mind. And there was an appreciation that flu could be more devastating to human life than war itself. So these commissions were extremely productive. They developed 10 new and improved vaccines in as many years. Some of these were in time for specific missions. We had a Japanese encephalitis vaccine in anticipation of a land invasion in Japan. We developed a botulinum toxoid because we had intelligence, turned out to be faulty intelligence, that the Germans were loading botulinum toxin, which is the most toxic substance on Earth, into V1 bombs. And so we developed this antidote for it and shipped it over before D-Day for the troops. We determined that, in fact, this was faulty intelligence. We didn't actually administer that vaccine, but the responsiveness was really remarkable. And very significantly, we developed the first flu vaccine in approximately 19 months from start to end, 10 million doses of a licensed vaccine by 1944. This is Tommy Francis, who led that commission. And here's Albert Sabin of polio fame. He started out, here he is, in a military research lab in Okinawa, and he developed the first Japanese encephalitis vaccine, 15 months from start to finish. It was not a perfect vaccine. It was quite crude. Essentially, they took mouse brains, I think those might even be mice he's got on there, and put them in a blender more or less and deactivated the vaccine and shot it into troops, but it did protect them from Japanese encephalitis. This is James Conant. He was chair of the National Defense Research Committee during World War II, which was responsible in part for the Manhattan Project. He was a chemist, made poison gases in World War I. Just to make you like him even more, he promoted the use of the SAT, big advocate for the beginning of standardized testing, and then became president of Harvard. But as chair, he really, of the NRDC, really thought a lot about how to mobilize science and organize research for war. And he wrote an article in the New York Times that really encapsulated a key insight for how to do this, which is there's a big difference between applied science and basic science. So basic science being a discovery process, which is open to serendipity. Applied science being, we know how to do this, we just need to coordinate in a way that's going to get it done efficiently and effectively. So he said there's only one proven method of assisting the advancement of pure science, that of picking men of genius, backing them heavily, and leaving them to direct themselves. Vannevar Bush talked about this a lot too. He called it giving a man his head, which is a very important principle. And then there's only one proven method of getting results in applied science, picking men of genius, backing them heavily, and keeping their aim on the target chosen. OSRD, which was the overarching Office of Scientific Research and Development, which Vannevar Bush ran, has achieved its results by the second procedure. Its objective was not to advance science, but to devise and improve the instrumentalities of war. So this is a really key point. When you look at the research and development mobilization for World War II, not just vaccines, but the atom bomb, the proximity fuse, radar, all of these things we developed, they were only productive, with some exceptions of the Manhattan Project, when the basic science was fairly well established. If you try to apply a top-down organization and that those basic principles have not been well established, it's going to go wrong. But when it is, we discovered that many of the key barriers to vaccine development in particular were organizational in nature and not the science. The science had existed for a flu vaccine, for example, since the 1930s, but it was distributed, it was in labs across the country. Nobody had really consolidated and applied everything that we knew about how to make a flu vaccine to really create a working product. And that is what these teams did. So they did some other things too. So it was sort of a new format for research and development. It was this public-private cooperation between industry and academia and military. And they had these no loss, no gain contracts. So, they weren't looking to make a huge profit, but they weren't looking for people to lose money either. And so, maybe there was a little bit of cost plus, but for the most part, it was considered no cost, no gain. And they were working in an exceptional policy space. And what I mean by this is they had the imminent threat of World War II. And so they were able to negotiate deals that had not been possible before. They were able to come together under certain partnerships that they never would have agreed to before. And place the universities, which are very, very independent, subjected themselves to this technocratic reorganization of their research programs for the purpose of mobilizing. So that was one piece of it. They also developed an entirely new way of conducting research. And there were a series of practices that I collectively call integrated research practices. And when you look at, and these had an impact going forward too. When I look at clusters of innovation over time, they tend to cluster around certain institutions. And these institutions implemented these research practices that were honed during World War II. So over the course of the 20th century, there have been 28 licensed vaccines. And military research institutes, especially the Walter Reed Army Institute of Research, made significant contributions to 18 out of those 28. And Merck and Company, the pharmaceutical company, made significant contributions to 10 out of 28. And they employed these practices. So the first component of it is top-down governance. So you get a project director that follows development from the field to the lab to the clinic to manufacturing. There are no sort of arm's length handoffs. There's, one person follows the entire thing. So there's a lot of situational awareness about upstream and downstream requirements, and it permits very timely go, no-go decisions. So when do we kill the project? When we give the project more money? This is how Tommy Francis conducted flu research in the 40s. It's how Salk conducted polio research in the 50s. And it's how Maurice Hilleman developed all of the vaccines that he developed, which, by the way, we're going to talk a little bit about Maurice. He was absolutely remarkable. He developed 40 vaccines over the course of his career. Quite possibly the most important and least well-known scientist of the 20th century, but we'll get back to him. So the other thing that they did is they had crossover research and training. So it was highly interdisciplinary, which is very important for vaccine research, which is in itself highly interdisciplinary. So they would define the problems and combine work processes across disciplines and development phases. And it was very explicit. They would have crossover teams. They would send investigators like on fellowships of sorts. So that you'd go do a rotation in the field, you'd do a rotation in the lab, you'd do a rotation in the clinic. You'd go into industry, so you'd understand what their upstream requirements were going to be, or downstream requirements were going to be for manufacturing a vaccine. And the third piece was cultural in nature. So the people who were working together had been working together. They did during World War II and after. They had high trust. They started out very united under this common threat, repeated interaction and interdisciplinary interaction. And this really facilitated open exchange and technology transfer, which really accelerated development times. And it's, characterized by a number of things, whether it's collective problem solving, open exchange of information, these site visits, these exchange programs, and strong social allegiance to one another, whether it's through a sense of urgency or social responsibility or patriotism. And vaccine development really had all three of those. So it was this was a poster that Merck, at wartime poster that Merck had posted about. And you can see that they really saw their role as they had a very patriotic approach towards working with and for the military during World War II. So these companies, they had this sense of duty, and it was true during World War II, and it persisted afterwards. So this is Don Metzger, who did vaccine development at the National Drug Company down in Swiftwater, Pennsylvania. It's now part of Sanofi Venice. But I had the opportunity to interview him about vaccine development during this time. He said the pharmaceutical industry looked at vaccine divisions as a public service, not as huge revenue generators, which they weren't. And in fact, for a period of time, the National Drug Company made zero profit on vaccines for years, and they continued to supply the military with what they needed regardless, because they saw this as a public service. Here's Vannevar Bush, who was director of OSRD, the Office of Scientific Research and Development. And he explained that there's a genuine need from a patriotic standpoint for industry to collaborate in research for defense. And he was very vocal about this and very successful in convincing industry to participate. And they did. So this is George Merck of Merck and Company. He headed the innocuously named War Research Service, which was an early offensive biological weapons research program. And he echoed many of these comments, which is that industry should assist war planners proactively and not wait, quote, for the emergency call of patriotism. This is interesting. So if you compare this to recent public statements from Ken Frazier, the current CEO of Merck & Company, he got out in front of everyone and said, the pharmaceutical industry has a very noble purpose, but capital markets don't go to church on Sunday. So the attitudes and the statements and the approach has really changed. And the sense of duty really trickled down. So this is Maurice Hilleman, who I had mentioned to you. He who had developed 40 vaccines, which is really extraordinary. 9 out of the 14 currently recommended childhood vaccines. So he was at Merck. He had gone from Walter Reed to Merck. And he had been on a roll with viral vaccines. Measles, mumps, rubella, had just finished those 3 in short order and gotten them licensed. And a man from the military walked into his office and said, "Maurice, we're having trouble with meningococcal meningitis in the Army. We need a vaccine." And Maurice threw down his papers. He looked at this guy. First of all, I should tell you, I interviewed Maurice for 3 days, and it was such a colorful interview that I could not print half of it. He swears like a sailor. But he threw down his papers and, Jesus Christ, blankety blank, 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 goes, "That's a bacterium, isn't it? I don't know anything about bacteria. I've only heard of them." And then he gathered himself and he said, but this would be a real disloyalty to the military. I owe it to them. I am going to make this vaccine. And he did. He made a meningococcal meningitis vaccine before there was any market for it. So the military was sort of on the bleeding edge of the need for this, infectious disease control because of their institutional living arrangements. And so he got Merck & Company to invest all of this money to develop the vaccine for which there was no market. And they eventually had to terminate the license of the vaccine because they were losing so much money on it. And then it eventually, the rest of the world caught up with the military, and we had lots of a need for a meningococcal meningitis vaccine because antibiotics stopped working. Long story short, he was able to respond to the needs of the military. So vaccines as a social good, not as a commodity, they were able to be developed that way. So why is this all so important? This culture and these relationships overcame market disincentives and provided the military with access to manufacturing and regulatory expertise. This was unique to that period of time, and that would change. It also paired developers, industry, with lead users, the military, to yield unique insights and rapid solutions. So this is a concept that's well understood in technological innovation, popularized by Eric von Hippel at MIT. So lead users are organizations or individuals that are ahead of the market trends and have needs that go far beyond that of the average user, the military. So for example, if you want to find the person who is the absolute best at developing brakes, you find the guy who develops the brakes for the jets that have to land on aircraft carriers. That is a lead user. So too is the military when it comes to infectious disease. This close collaboration between industry and the military had many positive, if unintended, consequences for global health. Number one, we built extensive overseas labs to discover and investigate disease. Number two, we had these vaccines, we were, as the developers and holding the IP and the licenses to them, that we could engage, we could offer this to the world. And it was really, the politics of it were really interesting during the Cold War. We had campaigns for polio, and we would fight with Russia over who had the opportunity to vaccinate a particular population, usually in some Cold War contested country. It was a battle for hearts and minds. And I would not be surprised to see the US and China do something similar once we have a COVID vaccine. It'd be interesting to watch. But these relationships and these practices had a very positive impact on innovation. So this chart shows the number of vaccine licenses per decade that represent innovative activity. Huge spike in the 40s, continues to be high in the 50s and the 60s, and then it starts to taper off. Incidentally, if you just look at the raw data, it does not look that way. Pure just number of vaccine licenses, it's hard to tell that it's in fact tapering it off, but it is. If you look at these red bars, like in the 70s in particular, we had massive industry consolidation. And when that happened, if one company went out of business, they would transfer their license to another company. So it would show up as a new license, even though it didn't represent innovative activity. So it took some work to comb through all of that data, but when you do, you see that it is in fact falling, which was counterintuitive and not what people expected. Thought with the biotech revolution and what have you, it should be going up, but it wasn't. So a quick anecdote here, things were working well in the 50s and the 60s. So I wonder how we would have responded to a pandemic if we'd had one then. Well, it turns out we did. In 1957, we had a flu pandemic. I bet you've never heard of it. And that's because we responded so effectively. So here's what happened. Here's Maurice Hilleman. You can see him on the slide. And here he is at the Walter Reed Army Institute of Research, where he was in charge of respiratory diseases. And in April of 1957, he sat down and was reading the New York Times. And he saw this story with a picture of children lining up to see the doctor in Hong Kong with these glassy eyes, and reports that about 10% of the population in Hong Kong had been infected with a novel flu strain. And he just threw down the paper. He does a lot of throwing down of papers, and said, "My God, it's a pandemic." And immediately got on the phone and called one of these overseas labs that we had. They were a tremendous resource. He called one in Japan, and he said, "Do you guys have flu over there? If you do, I want you to swab the throats, or have soldiers spit into cups and send me those samples right away." And they did. And he immediately was able to isolate the novel flu strain. And he got his team to work here to develop a vaccine. Now, we had a hard time convincing people in the US government that they needed to respond, that this was a pandemic, and here's the strain, and here's the vaccine, and we need to scale up production immediately because this pandemic is going to hit the US in September, right when everyone's going back to school, and it's going to be a disaster. So we need this vaccine. And there was a lot of pushback. He even had government officials writing back saying, "What's a pandemic?" And so this is partly who he was, but he bypassed all of that. He made the vaccine, and he contacted the companies directly, 6 vaccine manufacturers in the US, and transferred the technology and told them how to make it. So here you can see some eggs. We used to grow the virus, we still do grow the virus in eggs. Sort of a tedious process. And amazingly, this is 1957, he bypassed what was the version of the FDA then, the regulatory body, who would normally have to sign off on this. He just said, "Look, I know it works. I'm not going to take time. I'm not going to waste any time working through the regulators." And lo and behold, in June, we had the very first lots of vaccine being developed by these 6 companies. by July, we had the first vaccinations. In 3 months, we had 40 million doses and an almost a largely vaccinated population by September, when the pandemic did in fact hit. We did not suffer severe consequences in the US. About 1 million died worldwide from this pandemic, but Maurice Hilleman was quite remarkable. So here's Elvis getting vaccinated. Just sort of a reminder that vaccines were pretty cool in the 50s and the 60s. So what went wrong? Okay, a lot changed in the 70s and the 80s. And a lot of those changes disrupted the working relationships that supported these integrated research practices and these relationships and the culture that supported this kind of research. One of the first things to happen was in 1976, the swine flu. So another flu pandemic. And people were concerned. Here we have another novel virus that's circulating in the population. There was one military recruit who had died from the virus at Fort Dix. And so we mobilized yet again, this time 300 million doses for the entire US population. And there was a massive attempt. President Ford had to provide indemnification to all companies before they would proceed, but they did, more or less at no profit, produce this vaccine, enough of it in time. And we started vaccinating people. Problem this time was, number one, there was no pandemic. It did not materialize. Number two, people were getting side effects from the vaccine. Maybe. It hasn't been, it was hard to tell, but there were some people who had had some negative side effects at about the same time that they got vaccinated. And so we stopped. And this became a real problem for these companies. First of all, they weren't making money on it. They thought, so at least, they could get some public relations benefits from cooperating with these government programs, but now they were getting criticized for it. So a lot of them looked at their vaccine divisions and said, why are we doing this? And divested of vaccine development. And so this is when we saw this massive consolidation of the industry, which was not good for innovation, because now you've got, 3 or 4 vaccine producers with product line monopolies and very little incentive to innovate. They have the monopoly. They don't need to come up with a better one to compete with anyone else. So that was one thing that happened. Then the institutional research base shifted too. So whereas Walter Reed had really been the center of excellence, a lot of the money and the talent started to shift over to the NIH, specifically NIAID for infectious disease. And they had a very different culture. They weren't working in teams and they didn't have a product development approach. These were academic investigators, much more like the pre-1940s model where, it was very bottom up, one lone scientist in a laboratory. And their incentive structures were different. They were interested in publications. That was their incentive structure. That's how they got promoted, not products. So when they came up with something that was relevant for vaccine development, the handoff to industry was much harder. They didn't really understand the downstream requirements of these candidates. And so it took longer, it cost more, it failed more often, the handoffs fumbled. The legal and the regulatory landscape changed, stronger IP protections, which really, if you think about, early on, this free exchange of information was very important. That became much harder. Stricter regulatory requirements. Maurice Hilleman was not going to be able to bypass the FDA ever again, even though it worked out okay for him that one time. Larger clinical trials. And the science and technology base changed too. So we had the biotech revolution, which you would think would be a boon for vaccine development, but it had the opposite effect, which was it became much harder to consolidate and apply all of the relevant research for vaccine development. It used to be that you could assemble the whole spectrum of skills under one roof. That was no longer true. So you had to, there was this growth of specialization and outsourcing required to assemble all the necessary expertise. So this contributed to longer development times and higher failure rates. And what we saw was, really a rising cost and time of development. So in the 70s, about 200 million in 6 years to market for each new vaccine. Today, it's closer to 2 billion and over 13 years to market for any new vaccine. Here's another view of it. So, what's contributing? Trials are getting bigger, more expensive. And this is what it looks like, incidentally, when there is a market for a vaccine. Okay, if your objective is to develop emergency medical countermeasures, vaccines for biodefense, pandemics, what have you, when there is no market, this problem is much bigger. So some factors driving the trend of higher cost and longer development times: privatization, downsizing, and outsourcing. And these are all fueled by falling trust in government. And they reduce our capacity for emergency planning and central coordination, two things that we had in spades in the 40s. So this drive towards privatization really began with post-war concerns about big government. Eisenhower administration put out an executive order to obtain goods and services from the private sector whenever possible. And this was fueled by faith in free markets, free trade, distrust of big government. And while it began with him, it became reinforced with subsequent administrations over time. And it was accompanied by falling trust in government. So one thing to bear in mind, trust in government was uncommonly high post the World War II victory. And then there were subsequent, so maybe it was higher than it normally would have been. But then we had subsequent episodes like Vietnam and civil rights protests, all of which did not help. But as trust went down, we began to outsource a growing portion of government tasks. And the government itself became hollowed out of a lot of the capabilities that it had once had. And the idea that the government is incompetent became a self-fulfilling prophecy. So if you look at US R&D investment over time, you can see on the bottom here, this, you can't see where I'm pointing, can you? The gap between federal and private R&D on the bottom. It is now so much so that the government must contract out. So it becomes a self-fulfilling prophecy. And the government has lost so much talent internally that it's a struggle to maintain effective oversight over the contracts that they do have. We have layers of subcontracts, we have cost overruns, we have magnification of indirect costs because there's multiple contracts down the line. And we get long development times, higher costs, and project failure. This is true for a lot of R&D in the government, but it's definitely true for vaccine development, as I will explain. And so as a consequence, the US defaults to this laissez-faire outsourcing approach, which cancels out a lot of the hoped for gains from private sector efficiency gains. We have these no bid contracts. We have situations where you have the fox minding the hen house, a lot of conflict of interest. And it's in this environment that we're trying to develop, have tried to develop emergency medical countermeasures for biodefense, and a COVID vaccine. So if you look at the history of biodefense post 9/11, we had a lot of programs put in place to fund and accelerate this kind of development, but it's been slow progress. If you just look at vaccines, there have only been 2 biodefense vaccines that we've developed. One is a smallpox vaccine, an updated smallpox vaccine, which was done right away, based on some pre-existing research, and a relicensed anthrax vaccine. So a next generation anthrax vaccine, the recombinant protective antigen vaccine, has been a top priority for over 20 years, and we've invested over $1 billion in that. We still don't have it. Why is that? It's not hard technologically, but we're working through all of these issues that I've just described, which makes it slow progress. So as we think now about how to proceed with a COVID vaccine, with Operation Warp Speed, it's important to remember some key wisdom from earlier efforts. Okay, so Vannevar Bush warned the US, he was looking at the new architecture for R&D in the US. If the country pours enough money into research, it will inevitably support the trivial and the mediocre. The supply of manpower is not unlimited. So, his point being, there are a few people who are really good at what they do, not everyone. But if you start throwing too much money after it, you're going to get mediocre research. And the key to success lies not in the sum of money, but in the form of organization, the ability of military officers, scientists, and engineers to work effectively in partnership. And this is a key takeaway, I think, for Operation Warp Speed, something to pay attention to. By contrast, in World War, at post 9/11, as we were building up this biodefense architecture, George Bush stated quite bluntly, it's money we've got to spend. It's money that will enable me to say we're doing everything we can to protect America. Well, that's only thinking about it halfway. And I hope that's not what we do for Operation Warp Speed. Throwing money at it is just reinforcing the Byzantine architecture that we have right now for vaccine development. It's not going to work. It's just going to accentuate all of the things that are not working currently. So reorganizing is going to be very important for this endeavor if we want to see it succeed in the timeline that's been stated. The other big risk that we face is vaccine nationalism. Okay, there's already evidence of it. Over 69 countries have banned or restricted the export of protective equipment, medical devices, or medicines. Trump tried to procure exclusive access to a vaccine in Germany. Chinese companies have been trying to do the same. We saw this with swine flu in 2009. One of the front runners was an Australian company, first to develop a vaccine. And even though it had not been the original plan, Australia required that they satisfy all demand for Australia before they started to fulfill export orders. So all COVID frontrunners are going to run the risk of becoming nationalized. That is a likely political scenario. But that will slow development, reduce access, and undercut vaccination strategies that would end the pandemic in the shortest period of time. So why would it slow development? There are a number of reasons, but one key one to keep your eye on is that global supply chains are tightly linked. India and China make the majority of active ingredients that we need for new medicines and vaccines and for generic medicines, a lot of the medicines that we're currently using to treat hospitalized COVID patients. So vaccine nationalism on any level is going to trigger some protective measures that could really slow development. These companies cannot function outside of these working trade relationships. I think you may have seen the op-ed that I wrote recently. I think it was assigned, but just briefly, you know, some of the reasons to participate in a international collaboration for a COVID vaccine are worth considering for all nations. It really is in their best interest. Vaccine development is not a zero-sum game. So if we work together, when you have a diversification strategy, it reduces your risk. You have a much broader portfolio and a coordinated portfolio. Your chances of succeeding are much higher. So just keep in mind, 90% of the vaccines that are developed fail. So if we have 100 candidates, then we might get 10. But if you're just working on an individual country basis, you might have 3 candidates. Your chances of getting locked into a failing candidate are pretty high. That's a high risk strategy. So then there's the question of scale. You also have more, you could pool more resources, which would allow countries to scale manufacturing capacity to socially efficient levels. So you want to have, if you're a company, you are not incentivized to invest heavily in capacity. You make more money if you can produce a vaccine that doesn't meet immediate demand, but stretches demand out over time. So somehow, you know, we need some scale of investment to create a large enough purchase order to incentivize companies to develop enough capacity so that when you have a vaccine, you have enough vaccine to have an effective vaccination strategy, not little bits over time that would allow transmission to continue. Coordination, so both the resources and the facilities could be redirected as needed. You can manage supply chain bottlenecks a lot better if we're all in this consortium together. And as I said, countries are less likely to get locked in by failure and or delay due to protectionist measures. And then finally, it looks like it got cut off, sorry, is the question of access. So international collaboration through a mechanism like the ACT Accelerator, which has been launched by the WHO and the European Commission, it allows vaccine to be procured as a public good, not as a commodity. And this is really critical because once we have a vaccine, the fastest way to end the pandemic is to administer the vaccine to those individuals that are most likely to transmit the virus. So the pizza delivery guy, the healthcare worker, the care provider in an elderly home, okay, across the world. So independent of nationality or ability to pay. So it allows for an efficient vaccination strategy that is equitable and that will end the vaccine in the shortest period of time. One that is nationally based, you could give the vaccine to potentially everyone in your country, but not everyone is at equal risk of transmitting the virus, and it's not the most efficient allocation strategy. And given how transmissible this virus is, it really does need to be addressed on a global scale because COVID anywhere affects populations everywhere. And then so just to wrap this up, as we're thinking a bit about some of the lessons that you could take away from successful mobilization operations, and as we're thinking about Operation Warp Speed, in reality, there'll be a couple of systems at once. We're going to have the US system, Operation Warp Speed. We're going to have the international system, the ACT Accelerator. China will have their own strategy. So these will all be sort of working a little bit together. You know, we might invest ultimately in one of these international schemes as an insurance policy. That would be a very rational thing to do. So you might have, you know, 2 irons and 2 fires at one time. But regardless of where this is happening, and how it is happening, what matters most is how you coordinate the research, how you organize the research. So one thing we want to do is reintroduce the cultural concept and the institutional support required to develop vaccines as a public good, especially for COVID. You want to reintroduce top-down direction for vaccine development teams. So once we have the basic science set, which we don't fully for COVID, then you really want to get the best minds and keep their aim on the target chosen. You want to build a community of practice, site visits, open data sharing provisions. That will make things go really fast. We are in this exceptional policy space. If ever there was a time to suspend a lot of the IP, this is it. This is the time to really have open data sharing. That will really accelerate development times. Pair developers with lead users. That often means a lot of in-country engagement. So the actual specifications for individual vaccines and their needs will vary country to country. Different populations, different cold chain capabilities. So important to pay attention to that. This is more important for the future, but you need to create a stable research community to retain lessons learned. So we've had this panic neglect funding cycle, which has left, we had a lot of SARS vaccines that were being developed after that outbreak in 2003, but the minute the outbreak burned out, so too did the funding, and those projects just died. Coronaviruses are here with us for the future, so we need to not just terminate all of this research and investment once the pandemic is over. They will come back, and we need to keep a pilot light on that research. Managing liability protection and PR benefits. We saw that with the swine flu affair, very important. And finally, you need to brand the mission to attract and retain talent. That's true for any sort of government mission going forward. The Gates Foundation has been amazing at that. The US government, less so, but it's time, I think, to reinvest in the government as a place that has capabilities and that can do things, because we need that central coordination for a COVID vaccine. So, thank you.